Afternoon, everyone, and welcome to our webinar today about the King's PhD programme in Mental Health Research for Health Professionals. My name is Gasimran Oberoi, and I manage the PhD programme. I'll be administering our webinar today, where we'll be shortly hearing from the rest of the programme team. Just a bit of housekeeping before we get started. Firstly, I wanted to remind everyone that today's webinar will be recorded and will be made available on our website afterwards. Secondly, if you haven't already done so, please kindly mute yourself during the presentation to minimize disturbances. And lastly, we'll be holding a Q&A at the end of this session, so please feel free to post any questions in the chat during the presentation or wait to the end of the session where you'll have the opportunity to use the raise hand function and ask a question yourself. As for the presentations today, we'll be covering the basics about the programme and the fellowship offer. We'll also talk a little about what you'll receive during the programme, and then we'll focus on the application process, discuss equality, diversity and inclusion, as well as the research culture of the programme. We'll also talk a bit about how the programme integrates with your clinical practice. And in the last part of the webinar, you'll have the chance to ask your questions and we'll go over any queries posted in the chat. Finally, we'll be holding a dedicated workshop for nurses, midwives and allied health professionals shortly after this session from around 1:30. And that will be specifically around the application process. So if that's of interest to you and you haven't already registered, I'll post a link in the chat to the Teams meeting so that you can join. All right, thank you very much, everyone. I think we're ready to get started. So I'm going to hand over to Matthew.
Thank you very much, Gasimran. So just a round of introductions. My name is Matthew Hotoff. I'm the Dean of the Institute of Psychiatry, Psychology and Neuroscience, and also the director of this programme. And I'm also responsible for making sure our team of supervisors do what they're meant to do. So that's my specific role in the programme. I'm just going to go around and ask my colleagues to introduce themselves. So first, Sandrine.
Yes, good morning or good afternoon, everyone. I'm very happy to be here. So I am the recruitment lead, and scientifically I'm more attached to the translational neuroscience theme. So I'm looking forward to tell you a little bit about the recruitment process and take on your question today.
Stephanie.
Hi, everyone. I'm Professor Stephanie Hatch. I'm a professor of sociology and epidemiology at the IOPPN. And I'm the Culture, Equality, Diversity, and Inclusion lead for the program and also Vice Dean of CEDI for the faculty. And my interest with regards to research are very much aligned with the social science and policy stream.
And Alan.
Afternoon, everybody. Alan Simpson. I'm Professor of Mental Health Nursing at King's. I'm leading on partner organisations and clinical liaison. So I'll talk to you a little bit more about that later on, about how that works. And yeah, my interest similarly around social policy and mental health. So anyway, thank you for being here.
And Rona. You're muted, Rona.
Gosh, still. Yeah, sorry about that. Yeah, very warm welcome to you all. Thank you so much for joining. I'm Professor Rona Morris. I'm a professor of psychology as applied to medicine, essentially a health psychologist by background. I head up the psychology department, and for this program, I'm the training and welfare lead. And probably most of my work would mostly be aligned within the kind of digital theme of this mental health program. So yeah, so that's me. Thank you.
And Gasimran, you've already introduced yourself, so we'll move on if that's okay, but Gasimran keeps us all in order and is responsible as one of the officers of the King's Clinical Academic Training Office, which is an infrastructure to support clinical academic careers, irrespective of whether you're a doctor, nurse, midwife, clinical psychologist, or any other health professional. So welcome again to the programme. The programme information is here. So firstly, we have been running this for 2 years so far, and we have another 3 years of admissions in our funding round. And the funding is provided from the Wellcome Trust. The funding basically allows us to award 5 fellowships each year. And those fellowships are for health professionals to do a PhD over 3 years. And those the fellowship covers home fees. So when you do a PhD, it's a qualification, and the university has fees for that qualification. That's covered. You don't need to worry about that. It covers your salary, and we aim to work with parity with clinical salaries. So the idea is that you do not lose out by taking this turn in your career, that you can actually carry on doing research without having to take a massive salary hit. It includes research costs up to £50,000 over the course of the fellowship. So it's quite generous by PhD standards. And it includes travel expenses, which include childcare expenses and training costs. So if you need to go abroad, for example, and childcare implications, that would be covered. You are awarded your PhD from King's College London. So there's a whole apparatus within the university which is responsible for ensuring that the PhD process operates effectively. So you would be seen within that apparatus as a PhD student of the university, but a rather special PhD student, because the clinical academics are in a special category, which we recognise, and that's all really the key point about this programme. You would have an employment contract with King's College London. So you would, in nearly all cases, our PhD fellows resign from their current job and then move over to King's College London. And we do our utmost to ensure that employment rights and pension issues and all those sorts of things are covered as effectively as possible. It is possible, and we have done this on occasions, but it has to be negotiated on an individual basis, to do this fellowship whilst continuing employment with your current organisation on a secondment. And sometimes that's necessary in order to ensure certain employment rights are maintained. But we generally expect people to join our faculty, our university in King's College London. I should say a little bit more about King's College London. It is a multi-faculty university. We have 9 faculties. Included those are 4 health faculties. The Institute of Psychiatry, Psychology and Neuroscience is where we as a team of directors are all based, but actually it isn't exclusively Institute of Psychiatry, Psychology and Neuroscience program. So you could be supervised by someone from the Faculty of Nursing, Midwifery and Palliative Care whilst doing a project which is about mental health, and your employment would be, your line management and supervision would be within that faculty rather than the Institute of Psychiatry, Psychology and Neuroscience. Similarly, you could be doing it in the Faculty of Life Sciences and Medicine, or I guess in the Faculty of Dentistry, FODOX, and I can't remember the full name of that. But we expect most of our PhD fellows to join us in the Institute of Psychiatry, Psychology and Neuroscience. I've mentioned already the King's Clinical Academic Training Office, and this is relatively new infrastructure which has been designed for the King's health faculties and our partner trusts, NHS trusts, to ensure that we do everything we can to smooth out clinical academic careers, which we recognise can be challenging. And then we have, because you're a PhD student of the university, there's an extensive programme of activities which are provided by the Health Sciences Doctoral Training Centre. So we have an apparatus which isn't just what we provide on this programme, but a whole load of other resources for training in other programmes. So we haven't reinvented the wheel. You have access to those programmes. Next slide. So I'm going to talk to this slide and then I'm going to hand over to Sandrine. Is that correct? I think that is correct. So This is a sort of schematic of the program, and you can see on the left the year you're in the program, and on the right there's certain grey columns which we see as being critical to delivering the program, and then just certain things which we would see as being most people participating in. So you're currently in year -1, and that's about recruitment and PhD project writing and approval. And we'll talk through the process of application in a future slide. But the point is, this is a bit different from most PhD programs. So most PhD programs, you apply to a program where the projects have been pre-specified. So your supervisors your potential supervisors will have put forward a load of different projects which you may or may not choose to go for, and then you apply to the program saying, I want to do Professor X's project on subject Y, and we would normally appoint the people according to the merit of their application. Here, what we are inviting you to do is actually develop a PhD project proposal. So we'll go through that process in due course, but it's a distinct difference to the program, and that recognizes the fact that you typically are more mature, you have professional experience and so on, and you will have your own interests and things you want to do. And we want to enhance that and to make sure that you are actually doing something which fits you, rather than just simply taking something which is a sort of predefined project. Okay, so now assuming you've been successful, you join our program, and we do a lot of work trying to provide an induction and building a cohort of PhD fellows within the program. This is really important, that although you might be doing very different subjects, you actually form a bit of a peer group, because a lot of the issues you face will be similar. Irrespective of whether you're a nurse, a midwife, a doctor, a clinical psychologist, a physio, many of the issues will be similar. And then the program is arranged in 3 blocks, and these are sort of priority areas which we have defined. So the first one is on the left there, translational neuroscience research skills, translational neuroscience research. So that is really about saying that there's something which your understanding about neuroscience processes, brain processes, and how they relate to mental health. And that could be a study on neuroimaging. It could be a study on some basic cellular process, but it's essentially very much sort of the technical neuroscience component, which we would support you in developing and learning, but it's as applied to mental health. The second block is data science and digital technologies. So this is really about saying that there's huge amounts of data out there. The new opportunities which big data provide give opportunities to be able to say something about population mental health, or about the course of mental health disorders in individuals, using, for example, data from smartphones or wearables, but also that there are opportunities for intervention, and that you may be able to develop with your supervisor digital tools to help people with mental health problems negotiate their symptoms, negotiate disability which arises from their disorder better. And then the third group is around social science, public mental health and policy. And this is saying that mental health takes place in a social context. The disorders people experience have huge implications in terms of their life chances, that we need to understand how mental health problems affect public policy, which could be anything from the way in which the Mental Health Act is applied, all the way through to policies on education or the criminal justice system. So it's very broad indeed. So when you apply year -1. What you're doing is actually defining a project in one of these very broad areas. And the idea is that there is some focus around those areas, but it's not so prescriptive that it actually excludes people from being able to do things they're interested in. Towards the end of your first year, there's a PhD upgrade, report and viva. That's the same for everyone in our faculties. This is just really a means of being able to check whether progress is as it should be, and to have a bit of external scrutiny. And then we look at a whole range of other things in terms of training. So we expect you to be able to do clinical practice whilst you're on the program. So that's what flexibility of clinical practice means. The limits to that are usually 1 day a week, where you can go and do your clinical work in that day if you so wish. It's not mandatory, but you're allowed under the terms of the Wellcome funding to do 1 day a week of clinical, to keep your hand in and to, you know, and to develop new interests. We aim to get each fellow to have a range of bespoke training materials, so things which are done in order to define what you need, which would be done in collaboration with your supervisor, to try and work out the best training paths for you. If you're doing something on data science and digital, you might want to learn how to use fancy software packages and so on. It's that sort of training which is hopefully transferable and useful later in your career. And then we're also interested in building cohort activities, so trying to pull you together with a group of other PhD fellows in the program. Hopefully by the end of 3 years, you've got a PhD thesis and you go through the viva. And then we try and see this as something where you know, this is the sort of launch pad for a clinical academic career. So we try and support you in transition activities and future career destinations. Throughout the program, you're offered a mentor, someone external to us, who is able to provide hopefully impartial advice. And as with all PhD students in our faculty, you are expected to produce progress reports every 4 months. So we're very keen on making sure people have a really excellent experience and that we spot difficulties or barriers to your project early on and can put in mitigations as soon as possible. We also encourage feedback from fellows to our actual program. So that's a kind of rather long way of describing this complex slide, but I'm going to hand over now to Sandrine, who will take you through the application process. Thank you.
Thank you very much, Matthew. So now that Matthew got you hopefully very excited about this great program, how do you apply? So stage 1, the submission deadline is coming up. It's roughly within a month, a little bit more than a month. And then we have a shortlisting period, and then you would hear back from us in the week starting 11th of December. So then if you are selected, then if I can have the next slide, go Serum, please. Then if you are selected, and then again, I think you have to press twice. Yeah, thank you. So then if you, no, that's it. Then if you are selected, then this is when you can choose a supervisor. So you can reach out to the supervisor pool. So you can already have a look. So if you go on our webpage, I will put the link in the chat just right now. So if you go on our page and then the other one, then you can already explore who are the supervisor, and maybe you have done that already, and who is available. And then you keep scrolling down, and then you will see an entire list of supervisors building up. And if you are selected to go through stage 2, then you get access to actually additional video where the supervisor are introducing their research. If I can get the next slide, Kusira, thank you. Yeah, so yeah, stage 2, you can already have a look now who are the supervisor in the program and who you might be interested to be working with. So once you get from us, you hear back that you have been selected, you reach out, you select the potential supervisor you want to speak to, so you can, you know, reach out, speak to more than one, and see where it would be a best fit. But then we ask you to confirm who you are pairing with. usually by the end of January. So 29th of January, you would get a reminder email from us if you haven't written to us, like who are you proposing as your supervisors. Starts early to do that. So as soon as you hear from us in December, I would say start contacting the people to set up meetings, because it could be that one of the supervisors is very popular and maybe more than one candidate will reach out. So we need time to get the matches right. And then we move on to the second deadline, which is April. So you have a good couple of months to develop the application together with your supervisors. And if some of you have already downloaded the stage 2 application, it is a little bit daunting, but it's not that you are doing that on your own. You are doing that as a partner with your supervisor. So you might have an idea, you might have an area where you want to go, but it's a work that you are going to develop this project together. So it's not just you who has to fill this huge form, because you will see indeed in the form there is maybe some administrative term you don't know, but the supervisor, they know what we are asking. So you can focus on the science with the supervisor, and the administration, the supervisor should help you in completing all that. And then we have another session, another timeline for shortlisting. And then you hear from us at the end of April. So it's quite quick. And then we, whether or not you have been invited for an interview. And then by the end of May, you should hear from us if you have been offered a place or not in the program. And we expect you to start either in October. So we are flexible. You can have an October start or then a February start. So now I'm just going to go if I can have the next slide, please. Go, Simran. Thank you. So the eligibility. So again, if you go on the website, what I posted just 2 minutes ago, you will see that we have a specific eligibility requirement. So you must be practicing health or social care professional and be registered with a national professional regulatory body in the UK or Republic of Ireland. Medical graduate must be registered on a UK Republic of Ireland specialist training program or must be a registered GP. So we don't want people to waste their time applying to the program. What is clear is that this program is not recruiting fellows to undertake an intercalated MD PhD. There are other programs that do that. This is not the case. All fellows must have completed their undergraduate degree and be registered with the relevant professional body. We are not either supporting non-healthcare professional. So for people who are here on the call that are looking to do a PhD who are not health professional, they should not apply for that. King's has other program, really nice, great program, either Wellcome funded as well, or MRC funded, or BBSRC funded that you can have a look at. I'll put the link in the chat, but you will also get the slides. So I think it should be there. So we really intend to support healthcare professionals in this program. So if it's not the case for you, there are other programs that are better for you. Next slide, please. So now the selection criteria, or just stage one, sorry, just one click. So the selection criteria, so for stage one, I would advise you to download. So if you go on the website, you can download the standalone Word document of the questions that are going to be asked on the platform. So don't submit, or there's no way for you to submit actually the Word document, but I would advise you to prepare all your answers on the Word document, and then you can copy paste them quite quickly then on the online platform where you upload your application. So, and you will see the questions that are being asked, they are designed so that we can assess if you are aiming to pursue a research career, because this is the big aim of this program. So from the question, we will be able to assess if you aim to pursue research career. We want our candidate to show a clear understanding of how research will progress knowledge within the field of mental health, and you will see there is a direct question associated to this assessment. And then finally, regarding research experience and potential, you should be able to demonstrate that. So there's not a single example we can give, because you all have different paths and different background. But for example, it could be showing research experience through undergraduate or postgraduate research project experience or training, or it could also be informal placement, or it could be workplace roles. Maybe some of you within your work environment already have some research role. It could also be via academic training position for health professionals. So it's not that we can say you have to have this kind of experience. So please, think about your career so far and how you have experience researched, and tell us about that in the application. Thank you. So stage 2. So the stage 2, so you will have, then by stage 2, you will have submitted your research proposal. And within the research proposal as well, there's an entire section where you explain to us how you will be proposing on your training as well. So bespoke training that you will discuss with your supervisor. I had put the link of the HSDTC that has a lot of, for example, courses that you could mention in your application. But also it could be something very bespoke that is happening abroad, somewhere else, you want to put in your research training plan. So you are going to submit this big application stage 2 in collaboration with your supervisor, and using that together with the interview, we're going to assess your critical thinking. We are going to look at this personal development, so develop training plan, to develop the skill to underpin the future research career. So we are going to really assess that, what you wrote in this form, and of course the project. So and the project is going to be a big part of this assessment, so that to show that you have worked with your supervisor to develop something very clear, a significant research question, and a feasible project as well. It's very important. But you will see in there, we ask you, for example, to put a timeline so we can see, is this feasible? And finally, during the interview, we are going to assess your communication and engagement skills. So I think this is it for me. And then of course, I'm happy to take questions all the way at the end, whatever you have. And I'm passing the baton to Stephanie.
Great, thank you very much, Sandrine. So here, I just wanted to emphasize to everyone that equality, diversity, and inclusion is really key, and a key interconnected aspect of what we do. So I would say that EDI principles lay the foundation for all of our processes. So all that Sandrine has described to you about the process, it's really important to us. And also we do a lot of thinking about research culture as well. So these are, we want to make sure that we're both building and maintaining a positive, collaborative, and collegiate, and very important, respectful research culture in which PhD fellows can thrive. It's important that you know that we have a zero tolerance for bullying and harassment, and also the avenues for people to share any concerns that they may have or experiences that they're having along the way. Our work is supported by the wider faculty. So we have a really strong culture EDI team that provides us with a range of information and resources. So just to assure you that this is not just about, making sure that's in relationship to this program, but there's wider supports right across the faculty and the university. And then, of course, the PhD fellows and supervisors have a really strong voice that is central to our annual monitoring and evaluation of this program. So we encourage you, in thinking about your applications, to think about how EDI sort of, is reflected within your research. And not, if it doesn't seem immediately obvious, also think about how EDI, in terms of your ways of working. So embedding that in terms of your ways of working, that is equally as important. Could I have the next slide, please? So when we pulled together this program of work, we really wanted to emphasize 3 underrepresented groups. So we're particularly encouraging people with the characteristics listed here to apply for PhD fellowships. And those are health professionals with lived experiences of mental disorders, people from diverse racial and ethnic groups. And they specifically want to encourage those from racial and ethnic minoritized groups to apply. And also the third group, nurses who are underrepresented in mental health research in academia. And then I wanted to stress here that, you know, many of you may have had a career break, or you're a mature student. Please don't let that discourage you. That's something that it's really important that we make sure that we have a very inclusive program and very flexible in working with you, regardless of your circumstance. And with that, I'll pass over to Rona.
Right. Thanks very much, Steph. Yeah, I think that's all laid the foundation very well for me. So I don't have a massive amount to add, because some of what what's on here was covered by both Matthew and Steph. But I guess what I did want to highlight is the immense wealth of educational and welfare type facilities available to PhD students generally at King's, and what we've specifically embedded within this particular fellowship. So if you imagine the PhD fellow in the middle of the diagram here, the very important thing, as Stephanie pointed out, was the creation of this positive research culture, and particularly embedded within some of the key principles of CD and D&I. Then I'm going to talk you very briefly through what's surrounding here, but the main thing I wanted to emphasize firstly is that there will be some key training and cohort activities that people will be expected to attend. So there will be some core things around the induction and other things that the fellows maybe identify, or that we think are kind of crucial for everyone. But very importantly, actually, is that the training programs for each fellow are bespoke and done in consultation with what's available, and supervisors and the program team can help signpost people to where they need to go for these. If there isn't, there's a wealth of things available here, but if there isn't all the training that you're needing for your particular project, there is some funding available for some external training where needed. So we can cover most things really, depending on what the particular need of the fellow is. And an important thing is not only in terms of supporting fellows while they're actually in training, but the research support and training is also to support careers and the next step. So there's also a careers team who works with researchers particularly, and we've also heard about the particular work that's been done around clinical fellows as well, and the bodies created for that. Then just to point out with some of the key things in the circle that I think makes it the IOPPN and King's a particularly unique place to do a clinical fellowship. The one is our relationships with the King's Health Partners. We're very uniquely placed here, that we attach to 3 of the largest London NHS hospital trusts. So that's South London and the Maudsley, which is our kind of key mental health trust, but also for those who particularly work perhaps in the more, like myself, the mind-body area, or want to embed mental health within more acute or community type resources. We're also very closely linked with Guy's and St Thomas's and King's College Hospital. So, for people who don't necessarily have their own links, those are often very important in terms of embedding research and our relationships with them. Then in terms of just kind of overall career, as well as looking at kind of people's general mental health and well-being as well, we have a mentoring scheme where people get allocated an external mentor. So this is usually somebody who's a high flyer in a related field who can provide some mentoring. So we have a whole list of people who've already signed up to help mentor, but we will also link you in with people if there isn't somebody suitable on that link. Also, as our cohort builds, our idea is people who are in the second and third year will become a PH buddy or a kind of support person for new people coming in. And each person also gets allocated a personal academic tutor from the directorship, who is separate from the supervisory team, who will meet with people twice a year to kind of just discuss general issues and progress and how people are finding things. Then we've already heard a bit from Matthew about the King's Doctoral Training Partnership. So this is really academic sharing doctoral training resources. So what we do here is flag people to all the resources that are available. A lot of what you will also find that you link in with will depend on the research group or department that you're linked with. So related to your supervisors, kind of core affiliations, there's lots of things that happen within each of our departments in terms of seminars, workshops, all sorts of things. And then within some of the bigger departments, there's also some individualized research groups to link in with. So there's a support structure that happens both within the overall doctoral program, but very much within people's research specific groups and departments. And then very importantly, not that everybody necessarily needs it, but we have a well-established mental health support network at King's. So again, this is not specific to this program. It's really for all students across King's. So there's King's Counselling and Mental Health support services, and there's also a lot of online services that we can flag people if they are in a position where they're needing more welfare support as they go through. There's lots of student bodies to link with who provide various types of support specifically for students, both social and more specifically towards academia. And then, as we've already heard in terms of the progression and so forth that Matthew described, they're also within, depending on which faculty and department you're in, there are PhD subcommittees that help oversee progress and things like upgrades and so forth. So without throwing too much information, hopefully that kind of flags up some of the key areas for that will be available to people. So at this stage, I'm going to hand over to Alan, who's going to talk about the integration with clinical practice.
Thank you, Rona. Yeah, Matthew and Rona and others have mentioned this is very much about developing people who are interested in developing a clinical academic career. So whether or not you're hoping to move into the university sector but maintain a clinical presence, or very much work in the health services but apply your research skills, this is about developing those skills and knowledge for you to be able to do that. So a big part of this program is ensuring that we provide support to you to do that as well as possible. So as has been touched on already, we know from existing PhD fellows that they really value the flexibility in organising clinical work to maintain their clinical skills. And so we will be working with each successful applicant to make sure that they have suitable clinical placements or roles for them to maintain that up to a day a week alongside their PhD studies and to develop their future career. As Rona's mentioned, we ally with King's Health Partners very closely, so there's lots of potential clinical placements there for PhD students. But you may wish to remain with or make connections with some other external organisation. We can help you support you do that, and put in place suitable arrangements to ensure that happens successfully. Whatever your role with us, whether or not you choose to come and be employed by King's or be seconded into King's to do PhD, we'll work with you throughout setting up the contract to try and make sure that there's no loss of benefits in any way, and that your salary and pension and everything are all covered. We're gaining increasing experience of having those complex conversations and negotiations. Throughout your PhD fellowship, we'd be working with you right from the very beginning to explore with you your hopes for your future career plans, and to look at how we might support that better throughout your PhD program. And during round about the midway of your PhD program, there would be a specific meeting to review and consider your future career trajectory and how we might best support you in nurturing that. So it might be linking you with potential mentors, external mentors. It might be making connections with you people who've got experience of developing their careers in areas that you have, and that we very often know people working in similar areas that we can link you in with. We'd be looking at targeted support and mentoring from established experts in the field, including people who've got lots of expertise around those people developing clinical academic careers. And you've already heard that we've got an additional webinar later on for nurses and allied health professionals. And that's because we recognise that not only are is the research field and academia underrepresented amongst those professional groups, but also it's often harder for them to develop clinical academic careers. The pathways haven't been well established, and there are moves and things are happening to try and start improving that. But we're very keen to support people who are trying to develop those sorts of careers right from the start. Next slide, please. So in the third year, there'll be a specific focus amongst the cohort to look at their future clinical academic careers and how we can best support that. We can link in people with the National Institute of Health Research incubators, and we'll be arranging talks from particular experts, program officers and funders within King's and also external bodies who can come and give you advice on applying for future funding streams to further develop your career as a postdoctorate applicant. For medics, doctors, we can help you apply for NIHR academic clinical lectureships, and also for other health professionals, we can guide you towards appropriate postdoctoral fellowship opportunities and other funding streams that might be available to you. One of the things that I've learned through working at King's is King's are very well networked into these sorts of opportunities and have a great awareness of them and how best to apply for them, and to give you supervision support in doing so. Anyone who wishes to return to a full-time clinical role, but drawing on their research experience or working in the industry or third sector, again, that's something we can explore with you and look for people who might give you specialist advice on making sure that's brought about as a reality for you. Post-program support, we'll offer support way beyond the 3 years of the PhD study. We do have available a number of bridging fellowships of 6 months support for a transition into future fellowship applications or other schemes. We can also provide mentorship that goes beyond the end of the programme to continue supporting you in establishing that future career. And the KCL's Careers and Employability Service is available for up to 2 years following your graduation to ensure that we provide you the best support available to develop that clinical academic career. Thank you very much.
All right, we're now going to open the floor to questions. So if you'd like to ask a question directly, please use the raise hand function and unmute yourself when asked. If you're comfortable, you can also turn on your camera, but that's not essential. Alternatively, if you'd like to pop a question in the chat box, you can do so now. And if we haven't already, we'll get around to answering those questions as soon as possible. I'm aware that there's quite a few people on the call and we have limited time. So if we don't answer your question directly in this webinar, we'll get back to you via email to advise. All right, Matthew, I'm going to hand over to you.
Okay, well, I'll start going through the questions in the chat. So the first one from Rosemary, I think it's the first one. How much of our work will be possible to carry out remotely, and how much time roughly would we have to be on campus? I think the answer to that is it depends. It depends on your project and your supervisor and what is appropriate. So it's certainly not mandatory that you have to spend, you have to be here 24/7, 5 days a week or whatever. What we do, but on the other hand, we would discourage a completely remote PhD. That's not going to work. You need to actually be embedded in a department to have the conversations in the coffee room, all those sorts of things which you get from a workplace. It would be perfectly reasonable for someone to be doing 3 days a week in on campus and 2 days a week working from home or something like that. So it can flex. And obviously it depends a bit on the nature of your study. If you're doing something which involves neuroimaging participants, you're going to need to be in quite a lot. If you're doing something which is using some kind of remote technology, or you're using existing data from large databases, you don't need to be quite so much. But I'd certainly discourage people from thinking that this can all be done remotely. Is there a cap on the salary you're on from Abbas? I think the point here is essentially no. We have certain bands of, so we have certain categories of health professionals who are automatically eligible for the scheme. I suppose there is a sort of implied cap because we don't accept doctors who have completed their training apart from GPs. So it's a slightly unusual exclusion that, but if you're already a consultant, it's too late. There are other schemes you can go on, but it's too late for this scheme. So we accept doctors in training. We accept doctors on training schemes. Of course, they're doctors who are fully trained, but they're doctors who are completing their postgraduate training. There are other schemes we can advise on for people who find themselves out of that category because they're already consultants. And there's a follow-up comment about being a midwife wanting to do research in the area of perinatal mental health. That's absolutely in scope. We would absolutely encourage an application in that area. I think it's Trupti, international applicant registered with the General Dental Council UK. Does the programme cover international tuition? If not, what are my options? So the registration with a professional body, a professional regulatory body, has to be in the UK. But if you happen to be a non-UK citizen wanting to study here, that is possible, and we do offer a small number of fee waivers for international students. So that shouldn't discourage you from applying. Am I right in that, Simran? I see Sandrine's nodding. Yeah, okay, so we're good there. Okay.
Yeah.
Kissy, does being registered with the BABCP count as recognised body to apply for a PhD? I am going to look towards Rona, but I'm absolutely 99% confident that is a yes. Rona?
Yeah, I think it's gone to. We've had a few debates about this recently because some of the BABC registration is a bit newer. But yes, and we decided we would update our website with that information as well.
Okay, we're getting through these. Jana or Yana, apologies if I'm not pronouncing your name right. How many people are being shortlisted after stage 1 and 2? That's an interesting question. So we tend to get about 100 applicants at stage 1 in the last couple of rounds. And we have shortlisted down to about 25 or so to stage 2. We've then had a number of people at stage 2 haven't been able to follow through, so they've thought a bit more about it and wondered whether this was right for them and haven't been able to get the application in time. And then for the interview phase, we have shortlisted about 15. So you have to make 5 appointments. So it's something of that order. It is highly competitive at stage 1. We make stage 1 pretty light touch because it's really testing your readiness for the program and not putting people through the process of having to develop an application, all the rest of it. So we want to be fairly confident that you are in the right place to be able to develop an application and do so with a chance of success. So the idea is that we have quite a steep sort of process at that point, and then you've got a much better chance if you get through stage 1. From Abbas, there's what support is there for dyslexic students with dyslexia? I've put something in the chat about that. We have a whole apparatus around disability support for our students, and if you look down the chat, you'll find a link to a website. I don't know if there's anything else which I should cover there, colleagues.
I think I
Sandrine,
can.
do you want to talk about that? Yeah.
Yeah, so the link you put is very nice and should take Abbas to anything she needs to see. But I think what's not there yet on this link is that King's has an inclusion plan also for a postgraduate student. It's quite new. It didn't used to exist before, and now it is happening. So that means that when you are going to write up your upgrade, so you don't have to do it, but if you want to, then that means that they might give you more time, or you get a cover sheet as well, like when you were an undergrad. Same with your phases, your PhD phases at the end. You can disclose that to your examiner. You don't have to, but now that's an option.
Okay, thank you.
And there's also the PGR Disability Hub, which is a vital support system for PGRs like yourself. So if you are on the programme, there is a support system in place specifically around different disabilities.
So PGR, for those not familiar, is postgraduate research. It's a category of students which includes PhDs, but it's not exclusively PhD. But we use PGR more or less interchangeably with PhD. So there's a comment from Kissy. Does the salary include defined benefit pension to compensate for not working with the NHS? So pension rules are often feel highly complex, but we're very used to people who are on clinical contracts on the NHS pension scheme moving into the university and being able to continue on the NHS pension scheme. So that would be it's almost always the best answer. There is a possibility, I mean, several clinical academics I know have switched over to the USS scheme, which is an alternative pension scheme, but the university as an employer would expect to be supporting you in contributing to a pension, whichever that is, and would be making the employer contributions as required by the pension scheme. Alan, do you want to jump in there?
Yeah, thank you, Matthew. Yeah, just to say that the USS pension scheme is a defined benefits scheme up to a particular salary level. It's just about to be increased following the successful union campaign. So yeah, that is a defined pension, and it is a generous pension. I don't think it's quite as generous as the NHS, but it's close.
Okay, good. So Anne has asked a question. So this is a very good question. I'm interested to know whether you want nurses with mental health training, RMNs, or nurses interested in mental health as applied to other conditions. I'm interested in the psychological care and mental health needs of cancer patients, particularly as applied to survivorship. Is this the sort of thing that you would be encouraging? Yes, it is. We're very happy to have general trained nurses joining the programme. In fact, part of our pitch was saying that we want to have a diversity of professions doing mental health research. And we already have, I believe we've already got a general nurse on the programme. I may be wrong there. We've certainly got a midwife on the programme. And we're very happy to have, and both Rona and my background is in the space between mental and physical health. So we're very happy to have programmes to have PhD applications on the mental health aspects of physical disease. Just a caveat to that, it would be around mental health. So there are a whole lot of psychological processes which might be related to physical health problems. For example, adherence to a condition, adherence to treatment and so on. And that would start being on the borders of what's in scope. So if it's firmly around mental health, it could be, as you say, survivorship, that would be absolutely in scope. Alice says, I've already spoken to a potential supervisor and have a project idea. Would it be worth mentioning this in the first stage application form? Thanks. Ooh, that's an interesting question. I'm not sure if you should actually. Colleagues, comments on this one?
I don't think there's really space in the question to put that forward, but I mean, you wouldn't necessarily need to name someone, but if it's the area you are interested in, you will be able to expand in some of the questions. But yeah, I would not necessarily name the person in case there is conflict or potentially, but because here we are not looking yet at if you have found someone, or it's more about your, let's say, your interest in what type of research rather than a particular supervisor. But
so, I mean, there's space to say the kind of area you're interested in,
exactly.
What motivates you about that area, why you're excited about it. And we want people to be, we want to sort of, we want people to say that, what motivates them, why you're excited about doing this. because the personal motivation of putting 3 years of your life aside to do a PhD is absolutely crucial. Stephanie.
I think in the interest of equity across, and just sort of going back to our EDI principles, I'd encourage you not to mention it at this stage. It doesn't benefit you, and at the same token, it doesn't, it's not a barrier to those who haven't already spoken to supervisors. So it's really about you. It's very limited space. So please take, that opportunity to communicate and answer the questions rather than trying to shoehorn in additional information. So that's not a deciding factor in whether or not you get from stage 1 to stage 2.
Yeah, good advice. Okay, so next up is Catherine. If you're working less than full-time clinically due to caring responsibilities, can this be continued? So can you do the PhD on a part-time contract? Yes. So there is a slight complexity here, which I'll just rehearse briefly with you. So our PhD program, you have 2 versions of PhD registration, full-time and part-time. Full-time is counted as effectively it's full-time would include 4 days a week. So you could be doing 5 days a week, working 1 day a week of clinical, the rest of your time on your PhD, and that would count as full-time PhD registration. You can work, and then the part-time works on the basis of you working 50%, okay? And then everything is sort of extended in that way. So rather than being a 3-year PhD, it extends to a 6-year PhD, but it actually, there's flexibility in that. So lots of people doing a PhD part-time submit before the end of the 6 years. You're also employed by the organization, and as an employee, you can be working on a fraction of your of a total FTE, and that could be 60%, it could be 80%. We wouldn't register you to be working less than half time though on the program. So yes, we're very keen to be accommodating of people who are not working full time, but there are sometimes complexities about how actually that's organized. I hope that sort of covers it accurately. Michelle, sorry I've missed the first half of the session, no worries. Do we choose our own research supervisor, or is there a structured matching process for supervisor assignments? So basically, once you've got through stage 1 and been shortlisted, you're invited to put in an application and invited to make contact with the supervisors which are on the website, and you can develop a proposal with those individuals, and we will help you navigate that. So you may not know who the best supervisor is for the research idea you've got, and we will help try to match you appropriately. Okay. Catherine, as a medic, my understanding is that you take an UPI out of program, whatever the E stands for, from your training, but that would mean that you continue with employment in your current trust. Well, so you don't necessarily have to keep employment in your current trust. Most of the time people actually join the university as a member of staff. We have sometimes organised secondments for people moving from their employment to the university. It's usually the case that programs obviously want to get you back into the training program at the end, and that's something we negotiate with, it's something to negotiate with you, us, and the program to ensure that can happen smoothly. But we're very familiar with that sort of issue. Gemma says, is campus accommodation available for people who live outside London? What's the answer to that? I don't think so.
I think you can apply. You can apply for the roles of residence. So
okay.
we have PGR, postgraduate research students in their first year that have done that, but most of the time they are going to give priority to international students, so like PGR international students. but it is possible. So it's not unheard of, but
that's good.
Yeah.
So it's possible, but not
but
guaranteed.
You should have a backup plan, yeah.
And then
you would have time to set that up by the time you get an offer from us and you start, hopefully.
Bavik asks, who holds intellectual property for any innovation resulting from a project idea? Fellow, joint with supervisors, or the university? You're employed by the university, so is the supervisor, and the university holds the intellectual property fundamentally. It's important to be realistic about that. I mean that's the fundamental understanding I have of this. Others are not.
Correct. Yeah.
Afra, you identified 3 groups who you particularly want to attract, but I can't see where this is asked for in stage 1 application. Is this something we should be including in mitigating factors? Stephanie, do you want to answer that question?
So this is really about us encouraging these groups to apply. So the process that we use at stage 1 is really a blinded scoring process. So we try to redact any information. So this is really at stage 1. You know, that's what we're looking for. I don't think it's necessary to include that in your mitigating factors unless you feel as if this has contributed to explaining, you know, where you're at, career breaks, you know, et cetera. So whether, you know, just if it's important in terms of contextualizing your application, certainly do include it, but it's not something that we're taking into consideration as sort of fields that we're scoring on during the phase 1.
Good. Okay. Thank you. And then I'm aware we've got one person waiting to with a hand up, but one last question I think here from Jackie. May I ask what usually makes a good stage 1 application? It'd be interesting to get the other co-directors to say. I think what I'm looking for is enthusiasm, realism, a kind of understanding of a rigor which goes into a PhD and the challenge which might come with that. I mean, I think it's fair to say that people who have only ever worked in a purely clinical environment, have very limited contact with research, it's more difficult to write a great application, and we encourage people to look at ways of sort of getting a bit of research experience before coming into this, because if you've absolutely had none, but certainly we count, you know, if you've done a master's and a dissertation, you know, those sorts of things are important. But we are looking to identify people who are being realistic, because this is a big commitment. I mean, do you want to say anything more, colleagues?
Yeah, I can. I think it's demonstrating that you have an interest in research, and that you may not have been involved in conducting a big research study or something, but in your clinical work you may have drawn on research to inform your practice. You might have taken part in a QI, quality improvement project, or an audit which has informed your practice, or you may have gone off and done a small course or something. So it's if you've got any of those experiences that you can draw on and say, look, I am interested in research, these are some examples, that's really beneficial. And then I think the other end of it is thinking about how do you hope and intend to draw on this PhD to develop a research, a clinical academic career in the future. So is it that you want to carry on working in health services and draw on research and employ research to improve those services, or is it that you want to go into higher education institute to start working in there, doing research to inform practice. But have you got some thoughts about how you might develop that career, where you might do it, some training needs that might support that? So I think the two ends of what you've done so far and where you hope to go is going to be important as well.
I think
Yeah.
Stephanie.
Yeah, I just wanted to add, I think it sounds very straightforward, but just draft your answers to the questions, but then go back and ask yourself, have I actually answered the question? I think that's where people lose sight of the focus sometimes in it and tend to get scored lower. So really, on those last checks, please make sure you've answered the question.
So can I two last things. So one where we have seen already some people that stretch their interest to mental health, but actually it's not. So these people are quickly put aside. So don't do that. And then the number two is there's one question where we ask you, why do you need a PhD to do what you want to do? And sometimes people don't realize what you gain out of a PhD, and they answer, when we read it, I say, well, they don't need a PhD to do that. So reflect on what it is about to do a PhD and what you gain out of this training and how you really need it to pursue your career. Because sometimes the answer to that question is like, for us, like, well, this person can do that without a PhD, so up, out. So think about that as well.
Just a final point, I think, sort of linking back to what Matthew said about past research. I think one does need a certain amount of research knowledge before you do a PhD. It is important. So I think interest is important, but a certain amount of skills, because once you come into the PhD, there are support things around, but it does assume a certain knowledge base at the point. So there are still further years to apply. So if one doesn't feel that one's at that point, then there are ways and things one could do to kind of get that in place before the application, because you will get prioritized if you have you'll get more points if you have a reasonable knowledge of research skills and a way of demonstrating that.
Great. So we're nearly at time. There's one hand up from KP. I won't try and say the whole title because it's. But could you unmute and ask the question, please? Yeah.
Hi, I'm not quite sure why it came up KP. Can you hear me okay?
Not brilliantly. Can you get close to the mic?
How does that sound?
Yeah, that's a bit better.
It's a two-part question, really. I think I would be eligible health nurse 20 years. Just the PhD masters. My interest is patient, how that affects mental health. Bit nervous.
I think you have been breaking, so we heard every other word. I'm just wondering if it's not, or is it just me?
No.
Maybe it's better if you type it in the chat if we have trouble to hear you. I don't know.
I'll give it one more go if that's okay.
Yeah.
Is that better? Breaking up.
We're not hearing you, I'm afraid.
Okay, I'll try and type this, but I'm dyslexic, so unfortunately it doesn't go very fast. I don't know if you can hear me now.
Yeah, we can.
Is that any better?
Yeah.
Good. So I'm an experienced nurse. I've been to university, BA and MA. I'm interested in how government policy and legislation affects mental health. That's the sort of avenue I'm looking at. But I broke up again.
No, we can hear you.
I'm here. Can you hear me any better now?
So you said you're a mental health nurse. You've got a degree. You've done a master's, and you're interested in research on government policy and mental health.
That's right, yeah.
That would be in scope.
I think what I'll do is I'll get in touch with one of you guys and drop them an email if that's okay.
Yeah, that's fine.
That's fine. You might want to copy Simran in, and maybe Alan's the best person to ask in the first instance. Okay, we're at time, everybody. So thank you all for your contributions and questions. I hope we've been able to answer this. Simran's put up a contact point for further inquiries. So do send the applications in. I hope we haven't. I hope we've encouraged you. We're looking for, you know, an exciting range of different people and applications. So go for it, and look forward to seeing some of you in due course. Good luck. Thank you.
Thank you
Bye,
very much,
everyone.
everyone.
Thank you.
Thank you. Bye.